Friends, now in continuation with the child therapeutics video, this is my 10th video on child, and as I've always said, whenever you are treating a child, it is basically an emotional attachment of the parents also to the child. So give proper weightage to the symptoms of the child, what the child tells you, what you see in the child, and what the parents tell or the attendants tell about the child. Because if you are able to treat completely in children, your OPD will always keep going, because the parents get a lot of faith in you, so that you are a good prescriber, because you can treat this child, so automatically the family will join you and you have the whole family as your patient. So that's why I am continuing this child with therapeutic video for a longer part, because every drug has a peculiar symptoms which will differentiate your patients from the other patients. I am not telling you the whole Materia Medica or the whole child symptom of the drug, only the 3 marking symptoms, only the red line symptom which I have got in my practice and I have seen in my patients. That's what I am discussing in front of you. Next drug, Medorrhinum. Now in Medorrhinum, the most important symptom is children are pale and rachitic, dwarf and stunted in growth. This is a very important symptom I have seen in Medorrhinum, dwarfed and stunted in growth. Because whenever this type of children comes in your OPD, we have a prejudiced mind. Dwarf and stunted growth, the first drug we give is Abdequaem. Of course, in Abdequaem also it is a very important symptom, but whenever you are prescribing on a symptom, then you must have at least 2 or 3 drugs in your mind so that you can differentiate those drugs. So whenever Medorrhinum comes in your mind, pale, rachitic children, dwarf and stunted in growth, mentally dull and weak. This is now important. Mentally dull and weak. These children, Medorrhinum children, are very weak mentally and dull. Whole picture sometimes you get of Abdequaem, but you miss that drug and the child does not get better, and then you say Homeopathy में फर्क ही नहीं पड़ रहा है. It is not that, my friends. I have also made a lot of mistakes in my practice, and then gradually as my practice swelled up, I was able to differentiate and appreciate the symptoms which are written in our Materia Medica but missed in our day-to-day practice. So dwarf and stunted in growth like Abdequaem, mentally dull and weak, great heat and soreness. There's a great heat and soreness with enlargement of lymphatic glands all over the body. This is also a very important symptom of Medorrhinum. There is heat and soreness with enlargement of lymphatic glands. Lymph glands all over the body are swollen, my friends. This was the only symptoms I prescribed in 3 children. Lymphatic glands enlarged and swollen and sore, and Medorrhinum cured in 3 days. Such a beautiful prescription, Medorrhinum, and I got result in 3 days. In fact, the child's constitution was only Medorrhinum and everything improved. The child became very bright, his marks improved, his behavior improved, he became witty, he became very strong in constitution, no recurrent cough and cold, and the whole family was so impressed by homeopathy with only one symptom I took, that is great soreness and heat in lymphatic glands all over the body. Sometimes what happens, you prescribe a polychrist drug on a single symptom in a child, and that drug seems to be the constitution and management of the child, and the whole economy gets cured, and you find, oh God, what I have done just by one symptom. Sometimes though one symptom becomes your differentiating feature of that drug. Now this part I am talking about Materia Medica. In my one part of videos I will talk about my cases which I have cured with drugs, and I'll give you some rare drugs also which I have used in my practice with beautiful cures. So Medorrhinum, 2-3 symptoms, just remember: pale child, rachitic children, weak emaciated stunted growth, dull and weak mentally, lymphatic glands sore and heat all over the body. Medorrhinum. Lot many symptoms, but this symptom I found useful in a Medorrhinum child. Next drug, again a rare drug, that is Melilotus alba. Now Melilotus alba, we have seen this used in migraine where the head, severe throbbing, congestive headache, better epistaxis. I am not telling you that in children, but in child what I have found useful is convulsions. These symptoms, I had a case of convulsion children were cured with Melilotus. Melilotus of nervous children during dentation. Melilotus of nervous children. What is the meaning of nervous children? Go home and read in a Materia Medica. Go home and read, open the dictionary, and then if you don't try to contact me. I have given you my numbers. I'll tell you. This is a different part of Materia Medica where I'll try to describe you the meanings of the word nervous children, choleric temperament, sanguine temperament, when I go that part in my YouTube video, in my teaching videos. But you go home and read, and if you have any problem, you can always contact me on my WhatsApp number or clinic number. Whenever I get time, I definitely will tell you what I know in my practice, what I've seen in my practice, what in my caliber, what I know about homeopathy. Definitely I can't cure I can't cure everything, nor I don't know I know homeopathy everything. Is not like that. Whatever I know, I can share my experience with you. So Melilotus convulsions of nervous children during dentation. Now if this symptom is there, you must remember one drug, that is belladonna. Belladonna is very similar to Melilotus. Both have congestive headaches, both have throbbing headaches, both have bloodshot eyes. Both have the same symptom, convulsion in nervous children with or during dentation. In Melilotus, infantile spasms and epilepsy. Infantile spasms and epilepsy. So a whole picture of convulsions, epilepsy you will get in Melilotus. Compare it with belladonna. Sometimes what happens, clear-cut picture of belladonna and belladonna fails. I have found the result in Melilotus alba. In more than, I would say more than 15 to 20 cases where I failed with belladonna and Melilotus cured. Symptoms same: headache, convulsions of nervous children during dentation, infantile spasm and epilepsy. Whole picture of belladonna. So whenever belladonna you have prescribing, go home and read Melilotus and then compare the drug and then give the drug. Because if you are treating a case of convulsions or epilepsy, it's a very important condition of a patient, of a child, because if you are not able to treat that convulsions or epilepsy, then it affects the memory of children, then it affects the performance of the child. The family also is disturbed because there is no cure for convulsions or epilepsy in modern science. So if you are able to give relief or cure these complaints, you will feel satisfied and the whole family will feel satisfied. As a doctor, you feel that you have something good, done something good. So in a child, if a belladonna child is there, always compare it with Melilotus during dentation convulsions. Next drug, again a very rarely prescribed, I'll tell you, Mercurius dulcis, Merc dulcis it is said. The eustachian tubes are closed. In Merc dulcis, the eustachian tubes are closed. It is called as catharal deafness. What is cathar? It is mucus. The tubes are filled with mucus and there is deafness. So catharal deafness. बच्चा बोला डॉक्टर साहब पूरा बंद लग रहा है, ऐसा लग रहा है कुछ है नहीं, बंद लग रहा है, जाम लग रहा है पूरा. That is the words will the patient tell you. Catharal deafness and otorrhea in soric children. मतलब पूरे कान में ऐसा म्यूकस भरा हुआ है, पस भरा हुआ है, कठार है, डेफ हो गया है, and then it is called catharal deafness. The eustachian tubes are closed. That is a Merc dulcis child. Diarrhea of children's stools are grassy green. And I have seen patients come to डॉक्टर साहब इसका लैट्रिन पूरा हरारा निकलता है, कुछ बीमारी तो नहीं इसको. Merc dulcis, one dose will cure the complaint. Stools are grassy green. It is like chopped eggs. अभी आपको समझ में नहीं आ रहा है chopped eggs, तो घर जाना, अंडा उबालना, उसको चॉप करके देखने का कैसा है. Chopped eggs is Merc dulcis. In homeopathy, there are a lot of this type of words involve chopped eggs, like spinach. The stools are like sheep's dung, stools are grassy green, stools are cadaverous odor, a lot of things. But these symptoms are good to read and write. But then you have to appreciate those symptoms, what the patient is trying to tell you. If you appreciate this symptom, you will enjoy your practice. Because whatever you have read, you are seeing in your patients. No? Stools grassy green, Merc dulcis. Stools like chopped eggs, Merc dulcis. Profuse, the stools are so profuse, and because of the acridity of stools, because the stools are grassy green, chopped, like the whole anus becomes sore. डॉक्टर साहब लैट्रिन में बहुत दुखता है, बच्चा था लैट्रिन में बहुत दुखता है, बोल रहा है मम्मी दुख रहा है, दिख नहीं रहा वहाँ पे कुछ बोल, लेकिन लैट्रिन में दुख रहा है, जस्ट बिकॉज द स्टूल्स आर एक्रीड, दे आर ग्रासी ग्रीन, दे आर लाइक chopped eggs, and then it becomes Merc dulcis. So in Merc dulcis, remember 3-4 symptoms: eustachian tube closed, catarrhal deafness, otory and soric children's, stools grassy green, stools like chopped eggs. The stools are very profuse, causing soreness of the anus. That is the beauty of Merc dulcis. So in short, I have completed few drugs. In the next video, I'll add few more drugs. Thank you.